Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Laura is a 27-year-old female who is being seen today for psychiatric evaluation. She has no significant psychiatric or medical history and denies any history of substance abuse. She is being seen today because she is persistently having olfactory hallucinations. For the last 3 months, she has been having a progressive sense of smelling particularly foul odors, feces, rotting food, and trash with no obvious cause. She made the appointment because she had an uncle who had schizophrenia and he used to have hallucinations, although he was mostly hearing voices. The PMHNP knows that a priority of assessment includes A, brief psychiatric rating scale, B, toxicology screen, C, head imaging, or D, family history. This is an excellent question because all of these actually may have some utility in the assessment, but the question for you is, what is the priority of assessment? And the priority of assessment for this patient is C, head imaging. C is the correct answer. Again, not that the others may not have some utility here, but C is the priority. Head imaging is the priority. Non-auditory hallucinations are much more suggestive of a medical or organic or substance abuse etiology rather than a psychiatric etiology. With hallucinations, auditory hallucinations are most commonly associated with psychoses, and visual hallucinations may be as well. But other sensory hallucinations, things like olfactory, gustatory, taste, tactile hallucinations, it's appreciably more likely that there is an underlying medical or organic problem for several reasons. She has no psychiatric history, no known medical history. She denies substance abuse, and so, I mean, we'll take her at her word on that for the initial evaluation. No psychiatric history, no medical history, no substance use, and at the age of 27, she has rather abruptly developed olfactory hallucinations, particularly foul odor hallucinations. That's much more likely an organic problem than a psychiatric one. And so if you had to prioritize, if you could only pick one of these, it would be head imaging. You are looking for some sort of structural lesion or abnormality, and head imaging is number one. The brief psychiatric rating scale, it certainly may have some utility here. It is a good scale. It is often used clinically to evaluate for causes of psychiatric symptoms or the various types of psychiatric symptoms. Remember, it's an 18-point psychiatric scale. It evaluates things like somatic concerns, anxiety, conceptual disorganization, grandiosity, depression. I guess I don't need to recite all 18 to you, but you get the idea. That is a psychiatric rating scale. And given the circumstances here, we are just more concerned that Laura has an organic or medical etiology. A toxicology screen may also be useful. She did deny substance abuse, and in case-based things like board examination, case-based assessment in medicine, we do assume that the information presented to you is true. Of course, we all know in real life sometimes patients don't volunteer information about substance abuse at the initial evaluation. Sometimes they don't actually perceive something they're using as substance abuse. And so they may say no to that question. They may deny substance abuse for any number of reasons. However, a toxicology screen would still be useful because, there may be a substance use underlying the symptom presentation. And for that matter, family history will also be helpful. Is there any family history? Know that her uncle had schizophrenia, but is there any history of brain lesion? Is there any history of neurological dysfunction or abnormality? So again, this is an excellent question in that all of these may be part of your assessment, and you may include all of them in your plan for initial assessment. And yet, if you had to prioritize one, the one you would prioritize is the head imaging, because at this age, with this complete lack of history, the rather abrupt onset of this particular type of olfactory hallucination is much more suggestive of an organic problem rather than a psychiatric one.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.